Between 1990 and 2015, we've had dramatic decreases in deaths of children under the age of 5. In 1990, over 12 million children every single year under the age of 5 were dying. 25 years later, less than 6 million are dying. That's to be celebrated. That's the good news. The problem, on the other hand, is that of those who survive, over 250 million don't achieve their age-appropriate developmental milestones. So our focus is to really address that gap. These children end up having lifelong health problems, end up having lifelong societal problems, end up achieving up to a quarter less of their earnings. This affects the GDP of countries. So all of us need to be concerned about this. The best optimal period to be able to address developmental milestones, early childhood development, ECD, is through the health sector in the first 3 years of life. So whether it be interactive, nurturing play, whether it be utilizing low-cost, locally made materials to develop toys, whether it involves responsive care actions and talking and interacting and touching and massaging the babies and the children, this is all the work we're doing.
ECD has really changed me as a parent because it has really helped me on how to take care of my kids. These are my firstborns. I've been playing with them. I've been monitoring on their milestones, and I've been stimulating them by massaging them after washing. I'm really enjoying. Through ECD, it can really help the child to develop very fast.
When I first heard of ECD, it was something new because I knew ECD at school level. We didn't know there is this early child development in the issue of health.
The misconception that we have had is that when you take a child through an early learning program, then the child is receiving ECD services is erroneous. It's significant that we talk about ECD to encompass every service required for that child to survive, thrive, and be able to actualize their full potential.
We are training the health workers to integrate early childhood into their routine services. So for instance, when children are brought in for growth monitoring, then the health worker can share a key message around care and stimulation or around nutrition.
So if you look at a health facility, we've been trying to make the health facilities more mother and child friendly. We have play boxes or play spaces. And the idea is not just for the child to go and play while they're waiting to be seen, but the idea is for the parent to interact with the child and work with the child and use those play materials to stimulate the child. It's for the parents to learn the importance of those play materials, but to interact with the child as well.
Play is important for children because children learn through play. They learn through their senses, and we can only enhance this through provision of play materials where they can manipulate, where they can touch, they can smell, they can see, and that provides an environment where they are able to explore and learn.
What we don't want is to have the toys or playing kids, we get them from shopping mall. We want them to be as local as possible.
It has enabled me to encourage the mother to be playing with the kids themselves, not to leave the kids to play with the young ones. Initially, I didn't see the need of discussing that. But these days, I take long time with the mother discussing, and through that, I'm able to know what the mother is going through, the problem she's going through at home, and from that, I can help her come up with a proper plan on how to take care of her family.
Aneno ma tugo gi nyithindo no miyo nyathi bedo gi ng'eyo gik kaka nikech kitugo kode gima puonje donge. Akonyo gi kaka seche mag ng'wenyo lowo to kila chweyo negi moko chweyo negi nyathi kaka nyathi ma nyako chichwe ne nyathi ma nyako moting'o to ma wuoyi to chwe ne dhok koro puonjre gi dhogi go sembo to chwado to kwayo.
At the household level, we are working with community health workers. We have trained them and we have given them counseling cards that they use as they work with the caregivers.
I conduct health education at household levels. Christine, kale pok wadhire, nyathine weak, nyathi ok tug, nyathino sika ojunga.
Kane Nyamreche obiro mupuonjowa about ECD kata kaka inyalo rito nyathi. Naneno kata ka itugo gi nyathi, iwuoyo kode to king'iyo wang'e to ineno ka o-act maber.
Sani nyathi chiemo maber, kendo nyathi tugo, miyudo kata kowe oringo gi jowadgi, mano ok notim before.
Pogruok maneno maduong' en ni nyathi chiegni koda, kata yani nyathi en active, kata ka utugo neno ka more, kata kimiye chiemo neno ka ochamo maber, ngimane lokre, yani ngimane bedo maber.
This is a great time for early childhood development. We've got the Sustainable Development Goals that have identified early childhood development as a major milestone. We've got a broad array of global players who are working together in what has been called the Early Childhood Development Action Network, ECDAN. The goal is to be able to work closely with governments, with the private sector, with caregivers, with healthcare providers, to be able to provide the most enriched environment for these children. We're working closely with numerous governments across sub-Saharan Africa.
Like in Kenya, you can see we are in a pilot state. We have taken about 7 counties where we want to pilot care for child development. We've done regional trainings and we have sensitized basic training to policymakers.
We are working with the facilities, we are working with community health volunteers. We are capacity building the health workers on what they already should know, but we're putting more emphasis on why it is important to have aspects of play, aspects of stimulation. And health workers are now much more into looking at the developmental issues of children so that we are able to pick any delays in the milestones and then we refer appropriately or give the treatment when necessary.
Initially, these parents were not associating well with the 0 to 3 years. Like fathers were leaving the kids to the mothers, and the mother feels she's so busy, she leaves the kid to the younger sisters and brothers. But through continuous teaching and health education to the community, these days some fathers are accompanying mothers to hospital because they want to hear more on ECD. They feel through ECD, you will have a bright baby in future, you will have a healthy baby in future. But if you neglect this baby at that tender age, then you will have a problem in future.
I would say that it's still very early stages in terms of measuring the impact or the outcome on the children themselves. What we have been measuring is a change in practice around the parents. They realize that when they're playing with their children, when they're talking to their children, there's a difference in how the child is responding. The parent is actually feeling much more emotionally attached to the child as well. We're seeing children that are more responsive. So when parents or caregivers are playing and talking to them, they're much more responsive to the caregivers. So for us, we're seeing shifts in how the interaction is taking place and how it's improving the stimulation of these young children.
I used to love children before, but you see, coming out from ECD now, I came to understand what childhood really means, what bringing a child really means. A child is not to be shouted to, a child is to be shown a direction, and then a child is to be mentored.
Some of us, you're in your home and you hear children screaming outside. We consider it a nuisance. And so somehow we expect children to live in an environment which is more of like adults. So we expect them to be well dressed, clean, sitting up pretty, watching TV. But we know that that is not what the children need at that age. So I think even at a personal level, it makes us understand why children need to play, why children need to be stimulated, why right diet is needed, why the right emotional setup and family setup is necessary for development of these children.
The closer you get to the child, the closer you get to the mom, you create a bond, and even the services get better.
ECD has made me to be a responsible mother. Okay, with Cedric, I just used to buy toys for him. I never played with him that much. I never made toys. I never gave the boy too much love because I didn't know the benefits of doing those. Now I'm responsible. We are really connected. Noella will be learning a lot from me.
Early childhood development, it is a continuum of care. We don't want ECD to be a parallel program. We want it to be mainstream and integrated in existing programs.
We'd like to see that the Care for Child Development is integrated into the nurse training curricula and into the curricula of medical education. The nurses that have been trained in this, it's changed the way they're interacting with the children, and it's changed the way that the children are perceiving these health workers. They're not as afraid of these health workers.
Before ECD was introduced, we were saying like they're adding us more work. There's not much work in ECD. It spices up our services.
We are working with healthcare workers who are already trained by government, who are already integrating. So ECD is fitting in at no extra cost.
The approach to go is integration so that it is not dependent on donor funds.
We're not here to stay in the long term. The idea is how do you work with government and strengthen government systems so that they take on and continue the work that we were introducing and what we're supporting.
I think the time is now for all players to sit around one table, plan around one child, plan around delivering services that are of a quality that makes sure that the least served or the most underserved child is brought to the same level as that child who is living within an area where resources are plenty. Address the early years, change the early years, you change everything else.
Investment in ECD has long-term outcomes. There's better income generation in the long term. There's better social outcomes. You know, there's children that are less violent, sort of better members of society in the long term. And so I think we owe it to investing in these early years so that you can see these sorts of outcomes, both from an economic perspective, but also in terms of human beings, in terms of social behavior.
If this ECD is practiced well, in future we shall have a healthy nation.